My name is Dr. Susanna Banerjee. I'm the Chair of the Resilience Task Force and ESMO Director of Membership. The ESMO Resilience Task Force collaboration has recently launched the first survey addressing the impact of COVID-19 on oncology professionals. Our aim is to see how we as carers for cancer patients across the world are reacting to COVID-19 and affected by these challenges. Our well-being is fundamental to ensure that we continue to provide the best care for our patients now and beyond COVID-19. I'm delighted to be here with John Haanen, who's a member of the Resilience Task Force. So John, how has the COVID-19 pandemic affected your routine oncology practice?
Well, thank you, Susanna, for asking this question. I think all over the world, all people are being affected by COVID-19, right? So also medical oncologists are, where normally day was filled with a lot of patients based on this pandemic. We see now that a lot of patients are now staying at home because we don't want them to come to the hospital. It means also that the way we implement a treatment is a little bit different. We may postpone treatments if we think that they are at risk of developing this disease. I'm very much involved in translational clinical research. All that is back to a very low level. Many of the trials have been stopped, and also that is affecting the team that I'm working in, the people that work for me enormously. But also from a personal perspective, it has a lot of impact. So I'm not allowed to see my parents who live quite far away. My daughter is living far away. So the only thing you can do is do it by phone or by virtual meetings, which is different, of course. In many ways, it has affected me, and I can imagine that for many of my colleagues abroad, same things are happening.
Thank you, John. So issues you've raised will clearly resonate with many across the world. In my practice at the Royal Marsden, for example, I've certainly been now used to having a lot more telephone consultations with patients, and that has its own challenges, and we're all learning about that together. Did you feel sufficiently informed, equipped and protected delivering cancer care during this COVID-19 crisis?
I think at the beginning we really underestimated this crisis. Probably that was true for many of the countries. We saw the epidemic in the Netherlands coming with first patients being hospitalized and dying. And then we started slowly taking the first measures because we had no idea how this infectious disease would affect our cancer patients. We were also in lack of a lot of materials to protect ourselves, which is still something that is problematic in a country. Yes, I think that we were not completely prepared for this.
So a real concern is the long-term impact of COVID-19 on the oncology workforce. The ESMO Young Oncologist Burnout Survey, which occurred a few years ago, looked at this in young oncologists, and the burnout levels were high and varied across region. What was a real concern was that 74% of people responding in the survey reported that there was no hospital support services. So what can we do to support oncology staff to prevent the potential longer-term consequences of COVID-19?
And a very important question, I think. And of course, we have to start with bringing down the number of patients that are hospitalized and patients that are dying, so that patients are really not so afraid anymore. Cancer patients are not afraid anymore to come to the hospitals, and we can start building up our normal practices again. I think that's important for everybody. Second, as soon as we learn more about this, we have to inform everybody that perhaps having an anti-cancer treatment may not affect the COVID infection as much as we thought it would do. So that's important. The last thing is, I think we need to reach out to our colleagues, to really phone them, have meetings with them also abroad, to exchange experiences on how we are dealing with these problems. If you know about your colleagues going through the same problems as you already don't feel so much alone anymore. And of course, that can really help the well-being of our colleagues as well.
Thank you, John. I completely agree on those points. And one of the goals of the current Resilient Task Force survey is to collect information on coping strategies as well as the needs of oncology professionals. And this is aimed at hopefully developing and optimizing support services across countries. So, and just wanted to add that as part of this ESMO piece of work, we will be having videos that are uploaded on the website, sharing experiences, given the value of learning from each other, and hopefully supporting our well-being. So thank you for your time today, and I look forward to speaking to you on this topic in the future.
You're welcome. Bye-bye.